Hello everybody, this is the Planet Earth here. Today we're going to be doing a injection of scancobalin, vitamin B12 injection. I'm going to be doing it again. This will be the last injection. As we checked, my vitamin B levels are finally coming up. I was at like 150 and now I'm at 270. So we're definitely getting somewhere. Well, here's the I just don't want to show anything personal. Okay, here we go. Here's the prescription. It's scancobalin. It's a injectable, 1000 mcg, and we're gonna go ahead and inject again. So it's working. These injections are actually working, but as usual, as you know, I am scared of fucking needles. But let's just do this. Let's just get this done with. No, it's just temporary to get the B12 levels up, and then I'm gonna switch. I'm gonna only take it once every 2 or 3 months. I didn't know that I was that anemic. Comes in this. I'm trying to take the anxiety of vitamin B12 injections. Here's the prescription. Hold on. Yeah, you guys probably can't even see that. Yeah, it's whatever, it's in there. So they put it in this bottle because it's not supposed to be exposed to light much. So we're gonna go ahead and do this injection. And of course, I'm gonna have a lot of anxiety about doing this. Here it is again. This will be my last injection. By the way, you cannot really take too much vitamin B12. It is a water-soluble vitamin, so you're not going to have any issues if you took too much. It's a water-soluble vitamin. It is a cute bottle. So it's scancobalin. Well, so how you do it is you take this little protective sterile cover off, take it off like that. There's a thingamajigger. I don't know what the hell it's called. I don't care. And it's 1,000 milliliters. I don't even know how microliters. I don't know. Then we get the needle and we open this bad boy. How do they even open this? Oh. Okay, so here we go. We just go like this. I'm trying not to have anxiety. Oh boy, look at that needle. Ooh. Alright, well this thing isn't fucking scary, but I'm trying to show my YouTube audience that even with anxiety I can still inject. Oh my god, look at that needle. Oh. Anyways, okay, so let's just get this done with, okay? I just want to get this done with, and that's it. Okay, this shit is just retracting syringe. What the hell is a retracting syringe? Okay, alright, so always have your rubbing alcohol and a cotton ball with you at all times before doing this. But obviously before doing this, vitamin B12. It's a vitamin. Whoops, that's not how you do it. Okay, that's not how you do it. Oh, there we go. Oh, this one is very thin. Okay. This one's not looking... Oh, it's still scary, though. Yeah, it looks scary, of course. Holy shit. Nah, bro. Nah. This is like the third time I'm doing this, and I'm still scared shitless. But I'm gonna do it. Oh, man. This is... It's not an illegal drug. It's all legal. Is there something wrong with this needle? This thing is thin as fuck. Well, how does it go back in by itself? How does it says retracting needle. How do you make it retract? I don't know. A gateway vitamin? Really? My vitamin B12 levels are low as shoot. Alright, let's go ahead and... Hey! No, it's scary. How much air is in this damn thing? What the fuck? Yo, why is there so much air? What am I doing wrong? Why is there so much air? The needle is sterile, yes. There's so much air though. Oh, that's why. Okay, push it out. Oh, hell no, bro. Oh, man. Oh. Oh. Oh, hell no. Just one more injection. I don't have to worry about this for months. Oh, there's still a bubble in there. How do I get it out? There's no bubbles. Now there's no bubbles. Okay, there's nothing there. It's clear. It's clear. Yeah, it's good. It's good. It's good. It's good. This is vitamin B12. It's a vitamin B12 injection. I'm trying to show y'all. This is a it's a vitamin B12 injection shot, okay? When you have anemia, I have vitamin B12 deficiency, which is anemia. Well, it's B12 and I've been having a lot of neurological symptoms over the last 6-7 months. And I didn't know that my B12 level is okay, I'm getting anxious now. Okay, I'm actually getting anxious, but cobalamin. See, it's a vitamin, okay? It's just B12. And that's all to the moderators on YouTube. Well, it sounds like I've done this 2 times before, but it's still anxiety ridden, okay? You don't understand. It's very anxiety inducing, okay? I hope I don't pass out. Something happens with me when I do this myself. When somebody else does it, I have no problem. When I do it, sometimes I'll pass out. Well, the last 2 times I passed out. I just got to do this and get it over. Come on, guys. Give me some, I hate this shit. Doctor's orders. Okay, I'm gonna let it dry now. One more time. I'm just trying to show my audience here. Okay, guys, will I be okay? No bubbles, right? There's no bubbles. I don't see any. I don't see any bubbles. No bubbles, right? No. Okay. Alright, guys. This B12 has actually been helping my anxiety, not gonna lie. This is a valid person. Okay, I'm just so. Oh my god. Just do this one more time with a clean cotton ball, alright? Then it's gonna be okay. This is to be the 3rd time, but this will be the last injection of vitamin B12. I mean, this shit's scary. You don't understand how scary this shit looks. Like, look at this. This red shit going in your body. Why am I getting myself worked up? Just relax. Guys, I'm so scared right now. Like, I know what to expect, but I don't want to pass out. Okay, damn, jeez. Whoa. I didn't pass out this time. But I feel weak. I feel weak though. I feel weak. What do I do, guys? I feel weak. Because it's the initial injection that gets me nervous. My heart's beating normally. Guys, what do I do about the needle? How do I... It says a retracting syringe. How do you make it retract? How do you make the needle retract? How do you make the needle retract? It says it retracts. So how does it... I don't know how do you make the needle... How do you make the needle retract? Do I just pound it against the... I guess it doesn't retract. I guess... With retracting precision guide needle. Of course you only use them once. I guess I'll just put this back on and throw it out. There. Good enough. Alright guys, I'm nervous right now. What do I do? Do I lay down? Because I'm nervous just... The vitamin B... I don't know. Oh my god. I survived again. I survived again. I did. I survived. No, I have not had atrial fibrillation. But a low B12 is dangerous. It can cause neurological symptom, anxiety, cup of tea, or Ativan. Okay, Yep, lay down with feet propped up. Well, why am I getting clammy? Why am I... Is this expired? September of 2021. Okay, I'm getting nervous. My heart's not racing though. Is it because I'm just nervous because I injected myself? Is that why I'm feeling this way right now? Because I'm nervous about the injection? At least I don't have to do any more for at least 2 months, 3 months. No, but it's just that initial... It's just that initial burst of anxiety that I get after doing this makes me nervous. But I have to replenish my oxygen, my red blood cells. This is the only way to really do it is through B12 injection shots. My doctor was so concerned about my vitamin B12 that he said you got to do injections. Okay, I'm really nervous. Okay, now I'm not as nervous. Maybe it's just that initial rush of the body reacting to the B12. Okay, goes back in the vials. If anybody ever asks on YouTube, is that a valid prescription? Of course it is. Thanks, guys. I'm giving my body that B12 injection shot. It's doctor, doctor demanded. Oh, there it goes. Wait, I thought it... How do you make it retract? Okay, what do you do to make it retract? Oh, there it goes. It retracted. Oh my God, that's how you do it. Oh, that's how you make it retract. Okay. Look, it closed. So to make it retract, you have to push it really hard in all the way. And that's how you do it. And it retracts the needle. That's smart. Now nobody can get hurt. There's no possible way. They can't open this thing no more now and everything. Great. I'll throw this out of the CVS packaging. If anybody's curious, I did not do drugs, by the way, because that's dumb. But I want to show you guys just to make sure that the moderators know that this is a valid injection prescription. Hold on. See? It says inject 1000 mcg. See where it says that? It says to inject one. So no, I'm not a druggie. I'm just showing you that it's a valid prescription. So doctors and moderators out there on YouTube need to relax. You know, guys, these injections, they don't cost much if you have a very good discount coupon. It only costs $10 to get my B12 up. $30 so far, which I don't really have the money for, but that'll be the last injection now. It should go up to about $400 or $500 after this. Maybe more. But if you don't have a proper B12, you can have anemia, dizziness, vertigo, shortness of breath. I mean, in worst case scenario, you could cause certain arrhythmias because you don't have enough oxygen with blood saturation in your body. Feeling a little anxious right now. I'm a big guy, but I've lost a lot of weight for some reason. Let's go ahead and... Let me check my blood pressure, make sure it's okay. I'm gonna check my blood pressure just to make sure I'm okay. I get a little bit tired after the B12 injection. I always get tired at first. Oh my God, my blood pressure is really, really normal. 115/78. Damn. I haven't had good blood pressure in a long... You know, guys, my high blood pressure spikes, they've stopped since I've been taking these B12 injections. I'm not even joking. My blood pressure has stabilized. My heart rate is 71 beats per minute. Let me just... I've also been able to breathe better going up the hills. I used to get so out of breath, and now I'm not getting short of breath as much when going up the hills. And after this injection, I should be able to breathe normally going up hills now. Goose Fraba. Goose Fraba. So this is my blood pressure after taking a deep breath and then saying Goose Frabo. 115/84 with a pulse of 66. Little elevated on that diet. I'm working on that. I used to have it a lot higher. It used to be like 90, 95, or even 100. I'm working on it, but I'm getting it down. I'm restricting salt in my diet. I'm avoiding certain foods. I'm avoiding high salt content. I gotta eat something though. I feel a little lightheaded. Probably my blood sugar is going down. So it's a temporary side effect of B12 to me. Yep, plus they have potassium. And you need potassium to live. There's my sugar. Oh. Thank you guys for being here for me for that injection. I get really, really, really anxious. But I'm getting less anxious. Actually, now I'm getting less anxious. As you notice, it wasn't like a 40-minute video this time of just me waiting to inject it. Now it was like, I think, first 10, 15 minutes. I'm getting better at it. And I'm not getting as scared as the needles as I used to be now. Because if you do it correctly, if you do the injections correctly, well then guess what? If you do the injections correctly, it doesn't hurt. A lot of nurses, they just go, you want some injection? That's exactly what they do. Some nurses are like, oh yeah, you want an injection? Oh, guess what? This is what some of the mean nurses have done to me in the past. Okay, I'll give you an example. Okay, there's no more needle, right? But I'll give you an example. They'll be like, oh, so you want that injection, huh? You want this? Bah! And they don't even give you like a, I don't know, it's hard to explain. The nurses have no care. If they did injections soft like that, they wouldn't be as painful. And sometimes they try to inject you without letting the alcohol dry first. So it burns like a motherfucker, which is terrible. Now I know that if you be gentle when you inject patients with medication or myself, then obviously if you inject people with medications, if you do it softly and slowly, then there's no pain or there's very little pain. Also, if you do it in the right area for intramuscular injection, there's a area, it's a muscle, it's like a V, and you do it in there and you don't experience much pain. I learned that through my fiance actually, and through the internet. I've had a couple times about 5 years ago from uncontrolled high blood pressure. I'm on metoprolol and have to watch what I eat, but so far so good. I haven't had it ever since. Well, you don't even need high blood pressure medicine if you just restrict your salt diet to very little. Remember, a lot of foods already have a lot of sodium, naturally. I'm a nurse and have to give my hubby testosterone injections every 2 weeks. He said I'm the best shot giver ever. Now, the needle that if you're an RN, how often do you guys use these needles in an emergency room setting? Is it these type of needles that you use? Or is it bigger syringes? Well, this size is a... Because I like the butterfly needles, to be honest, but these are just for injections. These sizes are 25 millimeter syringe. I think that's correct. These are 25 millimeter syringe. Is it? Well, of course. This syringe is made in New Jersey. Franklin Lakes, New Jersey. 07417. Of course, it's made in New Jersey. They are a newer type of syringe. Well, it works, and I think it doesn't hurt as much either. Hopefully my B12 levels will be nice and good now. After this third injection and my final injection, I hope my B12 levels will stabilize normally now. They'll definitely be normal now. Now I gotta work on my folate and my vitamin D levels. Assuming coronavirus doesn't get worse, hopefully it gets better, and this goes away for a while. Ben, do you experience supraventricular ectopics? I don't know what that is. Sorry, I don't know what supraventricular ectopics is. Now the problem is I've never actually done an IV. I don't know. Nurses scare me when they try to get your blood through IVs, because a lot of the time the nurses don't do it correctly, and they don't hit it the first time and they don't hit it the second time. It takes them like, I don't know, like 50,000 times to do the injection correctly to get the catheter inside the vein, and that gives me a lot of anxiety because they're like moving it around and they're trying to feel for the vein. And they're like, I'm like, ow! That gives me a lot of anxiety, because if they don't get it right the first time, it hurts the patient, it hurts me, and it sucks. And my vein blows up, and then it's like bruised and everything for like 3 weeks. It's fucking terrible. If they don't do it correctly, it's like this gigantic vein burst, and it's just terrible. I wish nurses took better care and could find where that vein is the first time so they don't miss it. But unfortunately, nurses are not perfect either. Or techs. Even techs can do it. But it's scary when they do it like that and they push it in, but they never get the blood out. And then when they get the little vials and it sucks the blood out, sometimes the blood is being missed and they have to redo it again. It's terrible. I wish there was a... now there is one needle that you guys use. It's like a straight shot needle, kind of like the one needle like that. But it goes in and it just takes that blood out. There's one needle that they use in the emergency room that I like. And it'll get your blood the first time. It's almost 100% guarantee. And once they do it, that shit just pours right out. No. There's a specific needle that they use, specific company, and it's directly connected to a syringe, and all they do is pop the vial in so they can do blood testing, and it just shoots that blood right out real quick, and then they're able to take it off, and then if they want to put an IV drip, they can take out the air from the IV drip and then connect it immediately, and you're good to go. But then what they do is an IV flush jet. And then once they do the IV flush, they come out with the IV if they need to do IV for dehydration. Take out the air, and then boom. Vitamin B12 injection. When I first started nursing 35 years ago, I had an IV team. That's all I did every day. Now all nurses are trained to do it, and some do it better than others for sure. Anyways, thank you guys for watching. I wanted to do this video so people that do vitamin B12 injections will understand how important they are, especially if you have anemia. Now, if you have iron deficiency anemia and you have a very low iron count, you might have to do an iron infusion, and that could be very dangerous. If they do it too much, you're gone. If you do it too little, well, then you're not getting any therapy. So you got to be very careful with iron infusion. Anyways, guys, thank you for watching. I appreciate that. I have a lot more videos coming up. But I'm going to go lay down now because I feel a little weird from the injection. I'll get over it within a couple hours, but I feel a little bit weird. Thank you guys for watching. Bye.